Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So today we will review a few case studies from Genitourinary System. So let's begin. So the first case study is all about kidney procedure. So I don't want to read the entire procedure since they have given the procedure. Right nephrectomy with the partial uterectomy is a procedure. Okay, you can just read the procedural note. Please take 2 minutes time, pause the screen and read the procedure entire. So coming to option, we have 50234, 50220, 50230 and 50240. So this question is very simple, and in 2024 same question they've asked in 2024 CPC exam, and similar question you may expect in 2025 as well. Okay, but this question is not so complicated, but you may find little confusion between option B and option D. Okay, option B 50220 and option D 50240. So let's see what are those procedure and we'll conclude our correct answer. So coming to the option, you can see the description. So I told option B 50220 and option D 50240. People will find a little confused here. So see the description. 50220 is nephrectomy including partial uterectomy, any approach, any open approach. So in our procedural note, if you read that entire question, you will understand that the procedure was being done through open approach. And next 50240, so this is nephrectomy partial. So nephrectomy partial and nephrectomy total ureterectomy, that is 50234, and 50230 is it's a radical regional lymphadenectomy. So it goes to nephrectomy with radical regional lymphadenectomy. But if you refer this all the procedure very carefully, you will understand 50220 is the correct code. Okay, 50220 is the correct code since they have removed right kidney, entire procedure, like the entire kidney being removed. Okay, so nephrectomy, and then including partial uterectomy we are selecting because it was clear that they stated they have removed the portion or the partial uterectomy procedure they have performed. So answer is 50220. So next question is about right hydronephrosis, and so here the post-operative diagnosis says right hydronephrosis operation. So you need to know what is hydronephrosis. Hydronephrosis is like a medical condition where it categorized based on the dilation of kidney or maybe swelling in the kidneys. Okay, why do they get swell? Because there is too much built up urine, there is too much accumulation of urine due to some kind of obstruction or the blockage of urinary tract path. Okay, so people will develop hydronephrosis condition. So here which procedure they are utilizing, you have to check. So the procedure is cystoscopy and right retrograde pyelogram procedure. So cystoscopy being used to visualize, and with that they have also utilized right retrograde pyelogram. So retrograde pyelogram procedure is it's a diagnostic imaging study. Okay, so along with cystoscopy you have to check whether the imaging guidance code is included or excluded, and then you have to code it. Okay, so that's it. Please read the entire procedure note, and we'll see the options. So all options you can see imaging study they have added, but we just have to check what is the correct answer. And here let's see the code description. So coming to the option and the correct answer, so easily you can eliminate option A and option B because these two are irrelevant to the correct procedure, and you should have a confusion between option C and option D. So let's review the option C and D description. 52005 says cystourethropy with urethral catheterization with or without irrigation installation or uretropyelography. exclusive of radiologic service. Okay, so this is very important. So they did not mention inclusive of radiologic service. Instead, they said exclusive of radiologic service. So if they perform interpretation, okay, so if they perform radiologic service, that should be coded separately. Okay, in this code it is not included. And 52007, it is all about brush biopsy. So in our scenario, they did not perform any brush biopsy. And coming to the radiologic service code, so you can see 74400, it says urography, and 74420 urography retrograde. Okay, so urography retrograde, they did retrograde pyelography. Okay, so 74420 is correct, and again 52005 is correct. So answer being option D, 52005 with RT, because they did right procedure, and 74420 because of urography retrograde procedure. So we are utilizing 26 for the interpretation. Okay, so option D is the correct answer for the second question. Let's see one more question. So next question, 70-year-old with a significant pelvic prolapse and grade IV cystoscopy who has failed previous primary repair and is a status of post-hysterectomy. So here prolapse. So what is prolapse? Prolapse means like when organ or a body part slip or maybe fall from its original position to slightly a lower position. Okay, so there will be a slight adjustment in its original position. So that is called organ prolapse. So here patient is came with a significant pelvic prolapse, and what the procedure they did, she present for anterior repair of colpopexy. Colpopexy is like repairing the prolapsed organ. So now patient placed in a dorsal lithotomy position, general anesthesia was given, and then what else, vaginal pla were dissected. Okay, fatty tissue of sacrospinous ligament bilaterally gently fixed into a place along with the sacrospinous ligament approximately 2 cm away from the ischial spine. So the Oraphy procedure also they have performed. Oraphy is the vaginal suturing. So we'll see the options. So let's conclude our final answer. So in our question, you got three keywords. One was the procedure about oraphy, that is colporrhaphy, suturing of vagina, and also patient present for colpopexy. So colpopexy, which approach you have to check. So if you read the question, there is a keyword about this sacrospinous, the exact procedure. So for colpopexy you need to select 57282, and for colporrhaphy you need to check whether it was anterior or posterior. So it was clearly mentioned in the question, it was anterior procedure. Okay, so 57240. So check the option and just see option B. Option B is having correct code 57240 and 57282. Okay, that's it. Option B is correct. So we have discussed three scenarios. In these three scenarios, like as I said, everyone saying like is the same question is coming in exam. I am not putting any exam actual 2025 question, but it was 2024 questions. Okay, if you get, well and good. If you are not getting, at least you got an idea on how to deal with the question. Okay, so please, in this video today I did not had much time. I did not go through and read all the procedure note. Please pause the screen and read the question. And if you did not understand how I got the answer, please go back and check in your CPT book all the option description. You may able to understand. Okay, thank you all. Thank you for attending. Oh, sorry. Thank you for watching. It like it the mind is gone. Okay, thank you for watching.